Hello my viewers and welcome back to the channel. In today's video, I will be talking to you about checking your blood pressure. The systolic and the diastolic are the two numbers you see when you check your blood pressure. So this video will be explaining to you what these two numbers are and which of them you should consider to be more important and more interested in when checking your blood pressure. If you would want to understand all of these, please keep on watching. If you're seeing me for the first time, my name is Peace Tracy, and in this channel we talk about fertility, women's health, and everything health. So let's get started. So let me begin by explaining what blood pressure means. So blood pressure is simply the pressure the blood exerts on the arteries or the blood vessels when they are moving. So it is as simple as that. Now, when we talk about high blood pressure, it simply means when the pressure this blood exerts on the walls of the blood vessel are very high, and that is not a very good thing for you. Now, let's talk about the two things we are really trying to focus on in this video, which is the systolic and the diastolic pressure. So what is this systolic pressure? When you're checking your blood pressure, usually most people have this blood pressure machine at home. You'll find out that after you've checked your blood pressure, you have two numbers, one on top and one below. So the one on top is what we call the systolic pressure, and the one below is what we call the diastolic pressure. So this systolic blood pressure is the pressure the blood exerts on the walls of the blood vessels when the heart is contracting. As we all know, the heart contracts and relaxes. So when the heart is contracting, the pressure it exerts on the walls of this blood vessel is what we call the systolic pressure. This happens when the heart is contracting. On the other hand, we have the diastolic pressure, and this one is the pressure the blood vessels exerts on the walls of these blood vessels at the time the heart is relaxing. So you see the difference. This one occurs when the heart is contracting, the systolic, and this one is when the heart is relaxing. So that is the major difference between these two. Now, the big question comes, which one is more important? At this point, it's important that I let you know that the reading of blood pressure is measured in millimeters of mercury. So, in general, a healthy systolic pressure reading is expected to be less than 120 millimeters mercury for adults who are less than 60 years and to be 130 or less for adults who are 60 years or older. So that is just like a range that is seen to be generally acceptable. So it is important for us to know that the systolic pressure is an important indicator of cardiovascular health, as it reflects the amount of force the heart is exerting to pump blood through the blood vessels. So having a consistently high systolic pressure can increase one's risk of having a stroke, kidney disease, or even a heart disease. So it is really important that you always look out for the systolic pressure whenever you check your blood pressure. But that doesn't mean that the diastolic pressure is not important, because I'm coming to that. Then after which I will explain which of them is more important, which is the essence of this video, right? On the other hand, a normal resting diastolic blood pressure reading is expected to be less than 80 millimeters mercury. So this diastolic blood pressure reading is very important because it helps the coronary arteries to supply blood to the heart muscles. Low diastolic blood pressure readings can be caused by multiple factors like dehydration, prolonged bed rest, alcohol, or certain medications like diuretics, or even taking antihypertensives. Now, the big question is, which is more important, the systolic or the diastolic? Well, over the years, research has shown that both numbers are equally important in monitoring heart health. However, most studies show greater risk of stroke and heart disease related to higher systolic pressure compared to higher diastolic pressure. And this is especially true in people who are 50 years or over. And that could be the reason why doctors are more interested in monitoring the top number, which is the systolic pressure, more than the diastolic when it comes to people of this age. But that doesn't mean that the diastolic is not important at all. The reason for the difference in risk may be related to the force put on the arteries when blood rushes out of the heart. On the other hand, elevated diastolic pressure, which is the lower number, is predictive of future cardiac events, especially in younger adults, even when the systolic pressure seems to be normal. So, in summary, what have I said? The systolic or the diastolic, which is more important? As I already explained, both are equally important when it comes to monitoring the health of your heart. However, when it comes to older adults above the age of 50, it is usually important to monitor the systolic pressure more than the diastolic, as they are more predictive of future cardiac events like stroke, heart disease, and even the rest of them. So I hope this video makes sense to you. In summary, it is very important that we monitor both numbers whenever we are checking our blood pressure. And if we feel concerned about any of them, it is important that we reach out to our GP to find out if more monitoring could be done for us. If you really enjoyed this video, please do not forget to give me a like and subscribe to my channel, because here I talk about fertility, women's health, and everything health. Thank you for watching, and I'll see you in my next video. Bye for now.